The following demonstration is designed to further your understanding of the four-handed dentistry techniques. Your objective: working with an instructor and a mannequin. Demonstrate four-handed dentistry concepts by performing a minimum of 54 of 77 general assisting steps correctly. Safety and/or infection control violations will result in an automatic failure. Before beginning the procedure, complete the initial charting. Don your mask, wash your hands, and then don your gloves. Prior to any treatment, the dentist, assistant, and patient must perform a timeout. During the timeout procedure, the dental team and the patient will agree on who, meaning the correct patient, what, meaning the correct procedure, and where, which is where we verify the working site.
Who do we have and what are we doing?
All right, today we have A1C Know a Lot, and we are going to be doing the mesial occlusal of number 5 and facial of number 6.
Begin by passing the mouth mirror and explorer with the proper orientation.
So looking at the teeth, we got 8, 7, 6.
Once determined it is safe to proceed, we will need to anesthetize the patient. Pass the topical anesthetic on a cotton tip applicator wrapped with a 2x2 gauze. The dentist will take the topical anesthetic and place it near the injection site. Next, we will assemble the aspirating syringe. Begin by selecting the correct needle. Use the short needle for the maxillary arch and the long needle for the mandibular arch. Once selected, take the needle and hold it with both hands using the palm-to-palm technique. Keep your palms together while twisting off the hub. Place the hub on the tray and pick up the aspirating syringe. Screw on the needle while using the palm-to-palm technique. Pass the syringe using the hidden transfer method. Pass the syringe holding the barrel in your left hand and the cap in your right hand, and ask, "Doctor, do you have it?"
Doctor, do you have it?
I have it.
Once you have verbal confirmation, remove the cap but maintain a hold on the barrel. Once more, ask, "Doctor, do you have it?" Wait for their response and release the barrel.
Doctor, do you have it?
I have it.
It is not safe to pass a syringe back, so the doctor will recap the needle using the one-handed technique. Place the hub between the cotton forceps for your doctor. Due to a bitter aftertaste, the assistant will rinse and suction the patient's mouth using the three-way syringe and the saliva ejector. Next, remove the light and use the composite shade guide to select a shade for the anterior restoration.
What shade?
B2, please.
After you determine the shade, use your overglove to retrieve the composite from the drawer and drop it over the tray without cross-contaminating the overglove. During the procedure, we will need to use a rubber dam. Place the rubber dam clamps in the palm of your hand for clamp selection. After the dentist makes their selection, sit the chosen clamp to the side. Take one of the 18 inches of floss and pass it to the dentist. While the dentist uses the floss, take another piece of floss and create a ligature for the selected rubber dam clamp. Place the clamp on the rubber dam forceps with proper orientation and pass it to the dentist while holding the ligature. Do not let go of the ligature. The dentist will check if the selected clamp fits.
While holding the ligature, I'm going to check if it fits. It fits.
Next, you will need to punch holes in the rubber dam corresponding with the teeth needed to be isolated. Ask, "Doctor, which holes would you like punched?"
What holes would you like punched?
Holes 3 through 7, please.
Punch the holes and attach the rubber dam to the frame. Pass the frame to your doctor. Once the doctor places the frame, you will invert the rubber dam mesially and distally using floss. Then, pass the rubber dam clamp on the forceps to help secure the rubber dam. Next, you will pass the stellite to the doctor. The doctor will invert the rubber dam's facial and lingual surfaces while you provide short blasts of air. Once the rubber dam is secured, place a saliva ejector on the opposite side of the clamp. Great! Now that the rubber dam is in place, it is safe to begin tooth preparation. The dentist will need burrs to make initial cuts into the tooth surfaces. Pass the cotton forceps and then present the burr block and dappen dish for burr selection. Load the burrs safely and correctly into the handpieces using economy of motion. First, place the low-speed burr, the burr with a notch, into the low-speed handpiece. Next, place the friction grip burr, the smooth shank burr, in the high-speed handpiece. Pass the high-speed handpiece and provide suction using the high-volume evacuator, HVE. Use the thumb-to-nose technique for posterior teeth. For anterior teeth, use the modified pen grasp. Once initial preparation is completed, pass the spoon excavator and then hold the 2x2 gauze in your left hand.
Cavities. And cuts.
To complete the cavity prep, the dentist will use the low-speed handpiece. Pass the low speed and ask the dentist, "Would you like air, water, or suction?" Next, we will fine-tune the prep using hand-cutting instruments. Retrieve the chisel and pass for the anterior preparation.
Chisel now.
Keep a 2x2 in your right hand. Next, you will need to select and pass the appropriate GMT while holding the same 2x2. Remember the acronym DEMO, distal even, mesial odd. prior to placing any medication. You will need to rinse and suction the prepared teeth using the 3-way syringe and the HVE. Rinse and dry before you dye. Now that we have a clean preparation, we can apply the base. Mixed Di-Cal on a parchment pad using the Di-Cal instrument. Once mixed, wipe off the instrument before passing it to the dentist. Hold a 2x2 gauze in your left hand and hold the medication in your right hand. We are almost ready for the amalgam.
To help her out, she could ask her patient, please turn towards me, and the patient will move.
Place the Tafelmeyer on the prepared tooth and tighten the inner knob. Next, ask the dentist, which color wedge would you like?
What color wedge would you like?
I'd like the orange wedge, please.
Use the cotton forceps to place the wedge next to the preparation from the lingual aspect. Remember the saying, the boat floats on the water.
The doctor will check
It is now time to mix the amalgam.
that is incorrectly.
Activate the capsule by pressing the ends together. Insert the capsule into the amalgamator and ask the dentist,
mix.
how long would you like to mix the amalgam?
10 seconds, please.
Once mixing is complete, open the amalgamator cover, remove the capsule, and empty the mixed amalgam in the amalgam well. Quickly close the amalgam capsule to limit the escaping mercury vapors.
Would you like the larger small?
I'll be large, please.
Ask the dentist which end of the amalgam carrier they would like filled, and pass with proper orientation.
Would you like the larger small condenser?
Be prepared to pass the selected condenser with proper instrument transfer. Continue to fill the amalgam carrier until the well is empty or the dentist states that no more is needed.
Would you like more?
No, thank you.
Once the amalgam is condensed, pass the Explorer to remove excess amalgam before removing the matrix band. Now it is time to remove the wedge, Tafelmeyer, and the matrix band. We will use LIFO, last in, first out. Use the cotton forceps to remove the lodged wedge. To remove the Tafelmeyer, loosen only the outer knob. Once loose, the spindle should release the matrix band. Do not remove the matrix band off the tooth while still attached to the Tafelmeyer. Use cotton forceps to gently remove the band. Once removed, ask the dentist, which carver would you like?
Type PC, please.
Pass the requested carver with proper orientation. Now, we will treat the anterior tooth using composite. To help with the sequence of steps, use A, B, C, D. First, use the A, acid etch. Dispense a sufficient amount on the preparation and allow it to remain for 10 to 20 seconds. Then, rinse and dry using the HVE and the 3-way syringe. Next, place 1 drop of B, bonding agent, on a clean parchment pad. First, pass the microbrush to the doctor and hold the parchment paper with the bonding agent in your right hand. For the bond to work, it will need to be C, light cured. Ask the dentist, how many seconds would you like?
How long would you like it for?
10 seconds.
Light cure the preparation for the requested time using the protective shield.
The shield.
Now, we are ready for the second C. Place a small amount of composite material near the bonding agent.
Grab the stellite and 2x2.
Pass the stellite instrument and hold a clean 2x2 in your left hand and the composite in your right hand. Again, we will need to use the curing light. Ask the dentist, how many seconds would you like? Then light cure.
How long would you like it for?
10 seconds.
The final step for the anterior restoration is D, the sandpaper disc. Remove the burr from the low-speed handpiece and attach the mandrel. Secure the sandpaper disc with the rough side facing away. The dentist will use the sandpaper disc to smooth and polish the composite. During that time, ask if he or she will need suction, air, or water. Now it is time to remove the rubber dam. Pass the rubber dam forceps to remove the clamp and use the scissors to cut the interproximal septa of the rubber dam. Take the rubber dam off the frame and lay the rubber dam flat to check for missing pieces. Notify the dentist of any missing pieces.
Shield to check for missing pieces. If she likes to.
No missing pieces.
No missing pieces. Then she'll look in the mouth to check for missing pieces. And
Remove the saliva ejector.
Suction. And once we check for no missing pieces, we're gonna check
And pass the articulating paper and forceps to check for high spots. If necessary, you will need to ask the dentist which burnisher he or she will need. Once determined, pass the correct instrument with proper instrument exchange. Congratulations! Both you and the dentist did an excellent job, and it is almost time to dismiss the patient. First, you must rinse and suction the patient's mouth using the saliva ejector and three-way syringe.
Wipe the patient's face
Once
off.
you have done so, wipe off the patient's face using a moist 2x2 to remove any debris.
Wipe the 2x2 a little. And wipe your patient's face off good.
Safety is of the utmost importance. Prior to dismissing our patient, we will need to remove all obstructions. Begin by removing the unit tray and unit light. Next, remove the burrs from the handpieces to avoid staff or patient injury. Slowly move the patient chair down and forward to seat your patient upright. Take all the instruments from the doctor's tray and bring them back to the assistant's tray. Now, you will need to disassemble the aspirating syringe. Remember the acronym FIFO, first in, first out. First, remove the carpule and place it in the sharps container. Then, use the palm-to-palm technique to remove the needle from the threaded end. Be careful not to remove the cap accidentally. Be sure to dispose of the needle in the sharps container. Next, dispose the matrix band and the acid etch tip using palm to palm. Be careful not to contaminate the sharps container. Use the overglove to help open and close the sharps container. Now, with all the sharps removed, open the scrap amalgam container on the tray. Place the amalgam capsule in the container and empty the amalgam well and carrier. Now that all hazards are clear, it is safe to remove the patient napkin and safety glasses. Place all instruments and the glasses on the tray and cover them with a patient napkin, shiny side up. Finally, remove your gloves, mask, and wash your hands. Dismiss your patient by lowering the armrest and the patient's head. Remove the lid from the SIPC container and complete your admin work. Be sure to transfer item 9 to item 8 on the 603 in pen and erase item 9 after doing so. Add the narrative entry in item 10. Update the dental class and have the provider sign the entry prior to filing the record. This concludes the procedure. You will be working with multiple instructors. Flexibility and an understanding of the procedure is key to your success. Good luck.